function as well as aesthetics as well. So it's a good option.
Yeah. Speaking of aesthetics, I guess we definitely get asked a lot about, people say, I don't like the way my teeth look. What can I do to change that or fix it? Or
Yeah, we do hear that a lot. A lot of people
want everything wider and straighter.
Yeah, exactly. And these days, I think with whitening becoming so available, it's become the new norm. Found. Yeah, so I find that there's a lot of options in terms of fixing the aesthetics of somebody's smile, both inside the mouth and outside the mouth too. We do have, Kate does fast braces, we do Invisalign, and then we can even talk about, cosmetic veneers, either composite or porcelain. Do you guys find a lot of people don't know the difference? So, I mean, it comes down to preference, budget, and your initial dental condition as well as to which way you want to go. But in a nutshell, your composite veneers are essentially a procedure that's done by putting a resin over the front surface of your tooth. So it is a reversible procedure in that it doesn't involve cutting the tooth at all. And it's a way that you can get a relatively cost-effective, quick smile in one procedure. So it is done without any sort of pain, no anaesthetic in most cases, and you can walk away with your new smile that same day. On the flip side, porcelain is going to last you a lot longer, and porcelain reflects the natural tooth a lot better. So it will look a lot more natural than composite veneers. However, I wouldn't say it's a reversible procedure. Once you do the porcelain, that's your new smile for the next few decades in a lot of cases, as long as you can maintain the health of your mouth.
Yeah.
And Kate, you do fast braces, so that's another good way to
so I've been really enjoying